India is staring down a grave public health crisis, with its government promising to eradicate tuberculosis (TB) by the end of 2025. But the reality tells a different story. In the bustling Mumbai suburb of Govandi, one can hear the relentless coughs of its inhabitants, living in overcrowded conditions beneath tarpaulins and makeshift wooden shelters. The narrow, waterlogged streets feel suffocating. And here, in one of India's most important economic hubs, a lethal disease looms at every turn. Local medical professionals estimate that nearly half of the homes in this region are affected by tuberculosis, leading to death and stripping away the livelihoods of countless families. This localized disaster reflects a broader national health crisis. India accounts for 27% of the global TB burden, with the World Health Organization, WHO, reporting that a person succumbs to this infectious disease every 3 minutes. The Indian government has pledged to eradicate TB by 2025, yet many informed observers are quick to point out that this ambitious goal is far from achievable. The combination of systemic weaknesses in healthcare and socio-economic obstacles has hindered significant progress. Take Mehboob Sheikh as an example. He received his TB diagnosis 6 months ago, over 10 years after losing his wife to the same illness. For Sheikh, living with TB has become a stark reality. I've lost considerable weight, walking has become a struggle, and just speaking leaves me breathless. He shared with CNN, his emaciated figure and sunken eyes, stark markers of his plight. The disease has cost Sheikh his job at a printing facility. The overwhelming fatigue and weakness he experiences render him unable to withstand the demands of long working hours. He is currently undergoing a 9-month antibiotic regimen, yet with only 3 months left of treatment, signs of recovery remain nebulous. Meanwhile, his children, who are already malnourished and too young to fully comprehend the situation, linger nearby as he coughs. Once earning approximately 15,000 rupees, around $171 a month, Sheikh now struggles to keep up with their school tuition fees. If my body can endure, I will continue to live. If not, well, that would be the end for me. In 2018, Prime Minister Narendra Modi made headlines worldwide by astonishingly promising to eradicate TB by the year 2025, making this goal 5 years earlier than the WHO's international timeline. To eliminate TB, new cases must be reduced by 80% and deaths must be diminished by 90% compared to 2015 figures. Healthcare experts regarded this 2025 deadline as an incredibly lofty aspiration. Now, just months away from this target, TB continues to persist as one of India's most challenging public health dilemmas. Experts identify a complex interplay of biological, economic, and systemic healthcare issues as the core reasons behind India's ongoing battle with TB. We are a high-burden country, says Dr. Lancelot Pinto, a respiratory specialist in Mumbai. We lack the necessary resources to effectively scale up our response and eliminate TB by 2025. The bacterium, Mycobacterium tuberculosis, responsible for TB, has plagued humanity for thousands of years, with evidence discovered in ancient Egyptian mummies. It has the ability to remain dormant within the body for extended periods and can develop resistance to treatments, complicating eradication efforts. This disease flourishes in India's overcrowded, impoverished regions, where residents struggle to access reliable medical services. Health worker Pramila Pramod, who has worked in Govandi for a decade, notes that the number of TB cases she sees each month remains unchanged. Govandi's alleys present an ideal environment for TB transmission, lacking proper ventilation, plagued by open drains choked with refuse, and families of 6 crammed into single-room dwellings. Stigma surrounding the disease further complicates matters, with many patients opting to conceal their diagnoses from neighbors, educational institutions, and even spouses. Sometimes, I come across young women eligible for marriage, and their parents refuse to disclose their TB status, Pramod recounts, explaining that such concerns stem from fear that they won't find a suitable partner otherwise. The ongoing vulnerability is amplified by a faltering healthcare system. The public sector has long been marred by insufficient investment, staffing shortages, and outdated facilities. Meanwhile, the vast, largely unregulated private healthcare sector offers essential services, albeit at a steep cost that many cannot afford. India's approach to TB diagnosis poses another formidable obstacle. Approximately 75% of diagnoses still hinge on sputum microscopy, an outdated technique that can overlook active cases. In contrast, modern molecular tests that accurately identify TB's DNA are utilized in only about 25% of diagnoses. As per Dr. Pinto's observations, this gap translates to many undiagnosed infections, allowing dangerous, drug-resistant strains to proliferate without detection. Pinto emphasizes, unless we actively seek out and treat cases rather than simply waiting for symptoms to manifest, we will continue to miss numerous instances of the disease. 15-year-old Sufia Syed suffered from chest pain, fever, debilitating headaches, and chills for over a year before doctors finally diagnosed her 2 months ago. As TB ravaged her body, her weight plummeted from 88 pounds to just 55 pounds, 40 kilograms to 25 kilograms. Despite her sickness, she persisted in attending school, yet now finds it nearly impossible to concentrate on her studies due to nausea and sleepless nights. Every morning I wake up, feeling like I'm going to faint or lose consciousness completely, she reported. Sometimes, I can go 4 or 5 days without eating, though my mother insists I keep trying to eat. In response to this ongoing crisis, the government has worked to enhance efforts by providing free TB testing and medication through public health facilities, with an aim to ensure early diagnosis and treatment, particularly among vulnerable communities. Some progress has indeed been made. Since 2015, India has successfully reduced TB cases by 17.7%, nearly double the global average, and the number of deaths has decreased from 28 to 22 per 100,000 individuals, according to reports from India's Ministry of Health and Family Welfare. Yet, with only a few months remaining until the government's stated goal for 2025, the promise of eradication appears increasingly fragile. Challenges such as inadequate staffing to support comprehensive treatment, mapping difficulties in high-risk regions, and prevalent issues in individuals' willingness to seek health services have all played a role in the disease's stubborn persistence. As highlighted in a 2023 parliamentary report on the government's eradication objectives, the COVID-19 pandemic further complicated the situation as lockdowns disrupted screenings, delayed medical supplies, and diverted health workers, according to the same report. CNN has reached out to the Directorate General of Health Services for a statement regarding these ongoing issues. In India's remote areas, diagnosing tuberculosis can be a race against the clock, with long travel distances to clinics, a chronic lack of radiologists, and dependency on outdated sputum tests, resulting in infections remaining untreated until they become severely advanced. Since 1998, USAID has played a crucial role in filling some of these gaps, providing over $140 million to support grassroots healthcare networks in some of the country's hardest-to-reach locations. However, recent cuts in U.S. funding jeopardize the progress gained over the years. While the shortfall has not been publicly acknowledged, India has increased its domestic budgets and is employing a range of new tools, such as AI-driven X-rays, mobile testing vans, and drones to transport samples. Artificial intelligence, AI, is progressively being integrated into the battle against TB. Innovations like Cure.ai's chest X-ray technology allow for rapid scanning of lung images, identifying patients who may have active TB, a crucial advancement for countries where trained radiologists are not readily available. Confirmatory tests that analyze sputum, or detect the bacteria on a molecular level are more reliable. But they demand equipment, facilities, and time. Resources that are often scarce in slum and rural settings. AI-enhanced X-rays, however, are effectively bridging this gap by identifying potential TB cases and enabling health workers to promptly refer individuals for confirmatory tests, minimizing delays that could prove fatal. Experts point out, however, that these scans are not definitive tests for diagnosing TB, nor do they indicate whether the strain is drug-sensitive or resistant. They serve primarily as screening and triage tools, capturing cases earlier and preventing the loss of patients who may not be identified through standard symptom assessments, ensuring that individuals receive necessary sputum or molecular tests before commencing treatment. In a densely populated country like India, where crowded living conditions make early diagnosis essential to curbing TB transmission, these advancements could make a significant difference. These machines weigh less than 3.5 kilograms and can easily fit into a backpack, explained Dr. Shibu Vijayan, Ture AI's Chief Medical Officer for Global Health. They operate on batteries, enabling an entire community's screening process to be completed in a single day without relying on electrical power. The deployment of such devices is producing positive outcomes for individuals who may otherwise go unnoticed. For example, in Delhi, the Clinton Health Access Initiative has distributed over 30 of these portable machines to hard-to-reach regions, with many more deployed across the nation. We understand that certain populations, such as slum residents, migrant workers, and those exposed to dust, are particularly at risk, noted Vijayan. These tiny X-ray machines enable us to provide testing in their communities. Cost is another key breakthrough. These portable units are half the price of traditional hospital-grade X-ray equipment. The Indian government has welcomed this innovative approach, incorporating AI-driven screening into its national strategy. As per records from Cure AI, nearly 5 million X-rays have been conducted using these devices, with plans for acquiring more units. Aligning our goals with actionable strategies is as critical as meeting deadlines, Dr. Pinto remarked. As long as we keep moving in the right direction, we should celebrate these incremental victories and strive harder. Yet, for individuals like Sheikh, there seems little satisfaction in incremental successes. He continues to attend free treatment sessions at a local government hospital each month, with his son assisting him in carrying home his medications. However, the support extends only so far. Sheikh lamented his lack of access to monthly financial assistance that TB sufferers are entitled to under a federal program. No one has come to our aid, he stated. I have exhausted my savings. I need to find a way to provide for myself while I am still alive. But here's where it gets controversial. With limited success and a looming deadline, many question if the government's promises can ever translate into reality. Are these ambitious targets merely another political gesture, or could the integration of innovative testing solutions offer real hope in combating TB? What do you think about the government's approach? Share your thoughts and let's discuss.